Prometric questions and answers and rationals. 121 to 140. 121. The nurse is discussing breastfeeding with a postpartum client. Breastfeeding is contraindicated in the postpartum client with A. Diabetes, B. HIV, C. Hypertension, D. Thyroid disease. 121. The answer is B. Clients with HIV should not breastfeed because the infection can be transmitted to the baby through breast milk. The clients in answers A, C, and D, those with diabetes, hypertension, and thyroid disease, can be allowed to breastfeed. 122. A client is admitted to the labor and delivery unit complaining of vaginal bleeding with very little discomfort. The nurse's first action should be to A. Assess the fetal heart tones. B. Check for cervical dilation. C. Check for firmness of the uterus. D. Obtain a detailed history. 122. The answer is A. The symptoms of painless vaginal bleeding are consistent with placenta previa. Answers B, C, and D are incorrect. Cervical check for dilation is contraindicated because this can increase the bleeding. Checking for firmness of the uterus can be done, but the first action should be to check the fetal heart tones. A detailed history can be done later. 123. A client telephones the emergency room stating that she thinks she is in labor. The nurse should tell the client that labor has probably begun when A. Her contractions are 2 minutes apart. B. She has back pain and a bloody discharge. C. She experiences abdominal pain and frequent urination. D. Her contractions are 5 minutes apart. 123. The answer is D. The client should be advised to come to the labor and delivery unit when the contractions are every 5 minutes and consistent. She should also be told to report to the hospital if she experiences rupture of membranes or extreme bleeding. She should not wait until the contractions are every 2 minutes or until she has bloody discharge, so answers A and B are incorrect. Answer C is a vague answer and can be related to a urinary tract infection. 124. The nurse is teaching a group of prenatal clients about the effects of cigarette smoke on fetal development. Which characteristic is associated with babies born to mothers who smoked during pregnancy? A. Low birth weight. B. Large for gestational age. C. Preterm birth, but appropriate size for gestation. D. Growth retardation in weight and length. 124. The answer is A. Infants of mothers who smoke are often low in birth weight. Infants who are large for gestational age are associated with diabetic mothers, so answer B is incorrect. Preterm births are associated with smoking, but not with appropriate size for gestation, making answer C incorrect. Growth retardation is associated with smoking, but this does not affect the infant length, therefore, answer D is incorrect. 125. The physician has ordered an injection of RhoGam for the postpartum client whose blood type is A negative, but whose baby is O positive. To provide postpartum prophylaxis, RhoGam should be administered A. Within 72 hours of delivery. B. Within 1 week of delivery. C. Within 2 weeks of delivery. D. Within 1 month of delivery. 125. The answer is A. To provide protection against antibody production, RhoGam provides antibody protection. RhoGam can also be given during pregnancy. 126. After the physician performs an amniotomy, the nurse's first action should be to assess the A. Degree of cervical dilation. B. Fetal heart tones. C. Client's vital signs. D. Client's level of discomfort. 126. The answer is B. When the membranes rupture, there is often a transient drop in the fetal heart tones. The heart tones should return to baseline quickly. Any alteration in fetal heart tones, such as bradycardia or tachycardia, should be reported. After the fetal heart tones are assessed, the nurse should evaluate the cervical dilation, vital signs, and level of discomfort, making answers A, C, and D incorrect. 127. A client is admitted to the labor and delivery unit. The nurse performs a vaginal exam and determines that the client's cervix is 5 cm dilated with 75% effacement. Based on the nurse's assessment, the client is in which phase of labor? A. Active. B. Latent. C. Transition. D. Early. 127. The answer is A. The active phase of labor occurs when the client is dilated 4 to 7 cm. The latent or early phase of labor is from 1 cm to 3 cm in dilation, so answers B and D are incorrect. The transition phase of labor is 8 to 10 cm in dilation, making answer C incorrect. 128. A newborn with narcotic abstinence syndrome is admitted to the nursery. Nursing care of the newborn should include A. Teaching the mother to provide tactile stimulation. B. Wrapping the newborn snugly in a blanket. C. Placing the newborn in the infant seat. D. Initiating an early infant stimulation program. 128. The answer is B. The infant of an addicted mother will undergo withdrawal. Snugly wrapping the infant in a blanket will help prevent the muscle irritability that these babies often experience. Teaching the mother to provide tactile stimulation or provide for early infant stimulation are incorrect because he is irritable and needs quiet and little stimulation at this time, so answers A and D are incorrect. Placing the infant in an infant seat and answer C is incorrect because this will also cause movement that can increase muscle irritability. 129. A client elects to have epidural anesthesia to relieve the discomfort of labor. Following the initiation of epidural anesthesia, the nurse should give priority to A. Checking for cervical dilation. B. Placing the client in a supine position. C. Checking the client's blood pressure. D. Obtaining a fetal heart rate. 129. The answer is C. Following epidural anesthesia, the client should be checked for hypotension and signs of shock every 5 minutes for 15 minutes. The client can be checked for cervical dilation later after she is stable. The client should not be positioned supine because the anesthesia can move above the respiratory center and the client can stop breathing. Fetal heart tones should be assessed after the blood pressure is checked. Therefore, answers A, B, and D are incorrect. 130. The nurse is aware that the best way to prevent postoperative wound infection in the surgical client is to A. Administer a prescribed antibiotic. B. Wash her hands for 2 minutes before care. C. Wear a mask when providing care. D. Ask the client to cover her mouth when she coughs. 130. The answer is B. The best way to prevent postoperative wound infection is hand washing. Use of prescribed antibiotics will treat infection, not prevent infections, making answer A incorrect. Wearing a mask and asking the client to cover her mouth are good practices, but will not prevent wound infections, therefore, answers C and D are incorrect. 131. The elderly client is admitted to the emergency room. Which symptom is the client with a fractured hip most likely to exhibit? A. Pain. B. Misalignment. C. Cool extremity. D. Absence of pedal pulses. 131. The answer is B. The client with a hip fracture will most likely have misalignment. Answers A, C, and D are incorrect because all fractures cause pain, and coolness of the extremities and absence of pulses are indicative of compartment syndrome or peripheral vascular disease. 132. The nurse knows that a 60-year-old female client's susceptibility to osteoporosis is most likely related to A. Lack of exercise. B. Hormonal disturbances. C. Lack of calcium. D. Genetic predisposition. 132. The answer is B. After menopause, women lack hormones necessary to absorb and utilize calcium. Doing weight-bearing exercises and taking calcium supplements can help to prevent osteoporosis, but are not causes, so answers A and C are incorrect. Body types that frequently experience osteoporosis are thin Caucasian females, but they are not most likely related to osteoporosis, so answer D is incorrect. 133. A 2-year-old is admitted for repair of a fractured femur and is placed in Bryant's traction. Which finding by the nurse indicates that the traction is working properly? A. The infant no longer complains of pain. B. The buttocks are 15 degrees off the bed. C. The legs are suspended in the traction. D. The pins are secured within the pulley. 133. The answer is B. The infant's hips should be off the bed approximately 15 degrees in Bryant's traction. Answer A is incorrect because this does not indicate that the traction is working correctly, nor does C. Answer D is incorrect because Bryant's traction is a skin traction, not a skeletal traction. 134. Which statement is true regarding balanced skeletal traction? Balanced skeletal traction. A. Uses a Steinmann pin. B. Requires that both legs be secured. C. Utilizes Kirschner wires. D. Is used primarily to heal the fractured hips. 134. The answer is A. Balanced skeletal traction uses pins and screws. A Steinmann pin goes through large bones and is used to stabilize large bones such as the femur. Answer B is incorrect because only the affected leg is in traction. Kirschner wires are used to stabilize small bones such as fingers and toes. As in answer C, answer D is incorrect because this type of traction is not used for fractured hips. 135. The client is admitted for an open reduction internal fixation of a fractured hip. Immediately following surgery, the nurse should give priority to assessing the A. Serum collection, Daval, drain. B. Client's pain. C. Nutritional status. D. Immobilizer. 135. The answer is A. Bleeding is a common complication of orthopedic surgery. The blood collection device should be checked frequently to ensure that the client is not hemorrhaging. The client's pain should be assessed, but this is not life-threatening. When the client is in less danger, the nutritional status should be assessed and an immobilizer is not used. Thus, answers B, C, and D are incorrect. 136. Which statement made by the family member caring for the client with a percutaneous gastrostomy tube indicates understanding of the nurse's teaching? A. I must flush the tube with water after feedings and clamp the tube. B. I must check placement 4 times per day. C. I will report to the doctor any signs of indigestion. D. If my father is unable to swallow, I will discontinue the feeding and call the clinic. 136. The answer is A. The client's family member should be taught to flush the tube after each feeding and clamp the tube. The placement should be checked before feedings, and indigestion can occur with the PG tube, just as it can occur with any client, so answers B and C are incorrect. Medications can be ordered for indigestion, but it is not a reason for alarm. A percutaneous endoscopy gastrostomy tube is used for clients who have experienced difficulty swallowing. The tube is inserted directly into the stomach and does not require swallowing, therefore, answer D is incorrect. 137. The nurse is assessing the client with a total knee replacement 2 hours postoperative. Which information requires notification of the doctor? A. Scant bleeding on the dressing. B. Low-grade temperature. C. Hemoglobin of 7 gm. D. The urinary output has been 120 milliliters during the last hour. 137. The answer is C. The client with a total knee replacement should be assessed for anemia. An HGB of 7 is extremely low and might require a blood transfusion. Scant bleeding on the dressing is not extreme. Circle and date and time the bleeding and monitor for changes in the client's status. A low-grade temperature is not unusual after surgery. Ensure that the client is well hydrated and recheck the temperature in 1 hour. Voiding after surgery is also not uncommon and no need for concern, therefore, answers A, B, and D are incorrect. 138. The nurse is caring for the client with a 5-year-old diagnosis of plumbism. Which information in the health history is most likely related to the development of plumbism? A. The client has traveled out of the country in the last 6 months. B. The client's parents are skilled stained glass artists. C. The client lives in a house built in 1990. D. The client has several brothers and sisters. 138. The answer is B. The parents make stained glass as a hobby. Stained glass is put together with lead, which can drop on the work area, where the child can consume the lead beads. Answers A, C, and D do not pose a threat to the child. 139. A client with a total hip replacement requires special equipment. Which equipment would assist the client with a total hip replacement with activities of daily living? A. High seat commode. B. Recliner. C. TENS unit. D. Abduction pillow. 139. The answer is A. The equipment that can help with activities of daily living is the high seat commode. The hip should be kept higher than the knee. The recliner is good because it prevents 90 degrees flexion but does not help with daily activities. A TENS, transcutaneous electrical nerve stimulation, unit helps with pain management, and an abduction pillow is used to prevent adduction of the hip and possibly dislocation of the prosthesis. Therefore, answers B, C, and D are incorrect. 140. An elderly client with an abdominal surgery is admitted to the unit following surgery. In anticipation of complications of anesthesia and narcotic administration, the nurse should A. Administer oxygen via nasal cannula. B. Have Narcan, naloxone, available. C. Prepare to administer blood products. D. Prepare to do cardioresuscitation. 140. The answer is B. Narcan is the antidote for narcotic overdose. If hypoxia occurs, the client should have oxygen administered by mask, not cannula. There is no data to support the administration of blood products or cardioresuscitation, so answers A, C, and D are incorrect.